Good morning. So today we'll be talking about the submandibular region. What you're seeing here is the submandibular gland, which will be commonly kept for spotters in the anatomy. Below that is the digastric anterior belly, which you are seeing, and the submandibular gland is present in the digastric triangle. So now you're seeing the posterior belly of digastric along with the stylohyoid muscle. So that is a common facial vein which drains into the internal jugular vein. And when you lift the submandibular gland, you will be able to clearly visualize the anterior belly of digastric, the intermediate tendon, along with the stylohyoid muscle which is present over the intermediate tendon, which runs along with the posterior belly of digastric. So that is the intermediate tendon of digastric. Next we will look at another structure which closely resembles the intermediate tendon of digastric, and that is your hypoglossal nerve. That's the 12th cranial nerve, which often students confuse for the intermediate tendon of digastric. So clearly look whether it is completely a nerve resting on the hyoglossus muscle. So the muscle underneath that is the hyoglossus muscle. And as I said before, students often tend to get confused between the intermediate tendon of digastric and this hypoglossal nerve because both are in looped fashion in this region. So clearly look at the tendon. When you trace it back and forward, you can see the attached bellies of the intermediate tendon. Whereas the hypoglossal nerve, it will go and proceed towards the tongue lying on the hyoglossus muscle. And so that's how you differentiate between the two looped structures which you encounter in the submandibular region. Now you can look at another muscle which lies beneath the anterior belly of digastric, that is the mylohyoid muscle. So that is the mylohyoid muscle which demarcates the submandibular gland into superficial and deep parts. Now what you're seeing is the carotid artery which divides into an external carotid and internal carotid artery. This lies along with the internal jugular vein in the carotid sheath, and you can see some of the branches which are given off, that is the external carotid artery.